RTMS is a technology based on creating a magnetic pulse when you pass electricity through a metal coil. It is not the electricity that stimulates the body, it is the magnetic pulse that stimulates the cells. In this case, we use it to stimulate nerves or nerve cells that have been deactivated either via a depressed function or a damaged structure. For example, in stroke rehabilitation, you have the damage to the structure, and in conditions like depression, you have a depression of the function. And what RTMS does is not only it stimulates the nerves to work again, but it recreates the nerve pathways again, and we call that a neuroplastic effect. RTMS is used to treat many conditions. RTMS works where drugs fail and work as well as a replacement to drugs, whereby if people don't want to have drugs or cannot have drugs for whatever reason, whether they're pregnant, breastfeeding, they have allergies to drugs, they can't tolerate side effects, RTMS comes in very useful. Another condition where it's recommended by NICE is migraine. RTMS cuts the attack short, and not only that, but can be very useful in prevention of migraine attacks. Other conditions where RTMS is very useful are things like stroke rehabilitation. Parkinson's disease, also you get improvement in gait, movement, fluidity of movement. In things like Alzheimer's disease, you get improvement in memory. In chronic schizophrenia, you get improvement in memory. In pain syndromes, it reduces pain perception. In fibromyalgia, in chronic fatigue syndrome, they found that it improves quality of life and pain parameters regardless of the improvement of mood. All this is very encouraging, and certainly we're looking for more applications to use this condition, particularly that it has no harm and no side effects. RTMS works by delivering a physical pulse that people feel like a tap. People feel that physically in the head, but interestingly that tap penetrates the skull, goes through the other side and physically stimulates the brain, like as if you touch the brain with a magnetic field. And that tap stimulates the blood flow and the neuronal activity in the nerve cells, whereby the cells start to communicate more blood flow, more activity, more glucose utilization, and that restores the function of the cell. What you have from there on is what we call the neuroplastic effect, whereby the repeated stimulation and the activation of nerve cells helps to create new pathways in the brain to allow the cells to work for a longer time and for that to be sustainable. For example, when they looked at the recovery rates of depression with RTMS versus medication or electroconvulsive treatment, whilst with medication this figure was 13% and with ECT it was 13%. So it is clear that RTMS effects are long-lasting as opposed to those of medication or ECT. RTMS is effectively suitable for everybody except those with a history of seizures, which is uncontrollable. So if you have a seizure disorder, epilepsy, which has failed to respond to treatment, or you've had active seizures before or resistant seizures before, then RTMS may not be the best treatment for you because it could aggravate the seizures. Although the seizure risk with RTMS is far below the seizure risk you get with medication for depression, say. Other patients who would be suitable for it are those who don't want to take drugs, those in whom drug treatments fail, those who cannot tolerate drugs, have side effects from drugs, whether metabolic or physical or sexual side effects, weight gain. All these side effects will cause people to want to come off their drugs. Also, it would be suitable for women who are pregnant or for women who are breastfeeding, because you don't get any interference with the development of the fetus. It is too distant from the magnetic field, and you don't get any interference with breast milk production.